Hello, hello, everyone, and good afternoon. Welcome to our Amplify, Amp Up Community Engagement Activity over the 2026 season. I'm so excited that you are here today to learn more about our program, and thank you for taking time to be with us this afternoon. My name is Yolande Burris, and I am the program manager for Amplify, the African American Statewide Coordinating Center. And I do want to inform you that we are recording this webinar and it will be available for you for viewing and review within 24 hours. And we do also want to encourage you to share out with other organizations. So, Amplify is an African American statewide coordinating center. We're one of six priority population coordinating centers funded by the California Tobacco Prevention Program under the Cigarette Tax Initiative Proposition 56. We have been doing this work in the community and statewide for over 7 years, and we are in our eighth year of operation. And sadly, our final year of operation with this grant, and we really want to go out with a big bang, and we want your help. But I got to start at the beginning as to why we were funded and where we're at right now as Californians in the tobacco prevention landscape. And also, hopefully, by the end of our session, you'll want to join the fight with us. Now, at Amplify, we were established primarily to work with those who were funded by the state and community-based organizations that want to engage the African American and the Black diaspora more efficiently, more effectively. And we've been doing a wonderful work. But more importantly, we love Black people, and we love Black people who smoke. And we don't ever want to vilify them, but we want to encourage them and to educate them so that they know that it's not their fault, the situation that they're in, that it is systematic and it is predatory. And so we are always promoting and strive to foster a legacy of physical, mental, and spiritual wellness. Now, California has enacted strong state policies that have prohibited the sale of flavored tobacco products. Senate Bill 793 has been enacted and it restricts the sale of menthol and flavored products. This has been enacted for about 2 years. However, there have been some loopholes, and earlier this year, stronger reinforcement has been set in place at the retail level to ensure stricter fines and more enforcement on who is actually selling the products that have been banned. So we are only one of two states that have a comprehensive flavors and menthol policy in place. So California has set the precedents, and we are always being looked at as the go-to. And this project particularly has been looked at as the go-to. So we're very proud of it. Now, this is more information about Senate Bill 793 and the purpose of the coordinating centers. And I did already kind of discuss that. This is a little more comprehensive, going into exactly why we were funded and doing this work, how it coordinates with Senate Bill 793. But what I particularly want to point out to you is the actual trends of unit sales by flavor following California's flavored tobacco e-cigarette restriction. So this is, you'll see here, a graph from 2019 to 2025. And these first couple years are the years where we did not have a comprehensive flavor policy enacted throughout the state of California. It covers menthol and green, the blue is mint, yellow contains other flavors, and we have red for tobacco flavored products such as blunts, cigarillos, e-cigs, and we have the new menthol flavors in the dark blue, and then our white is unknown. So you'll see here in 2022, before our policy was enacted, we still had high usage rates, menthol. other flavors, and particularly tobacco flavors. Those were our main go-tos for our cigarette usage. Now, you'll see in 2023, as the Senate Bill 793 policy was enacted, we have a severe decline, particularly with our menthol flavors. But you'll see the blue emerge, and that is our new menthol non-menthols, which particularly is still provides a cooling sensation, but is not categorized as menthol. So we see those sales increase, and you see here that it's been steady with the blue. And we still, of course, have concern over tobacco flavors. We still have not seen a decline in the red tobacco flavored products as in other flavors. So yes, menthol has gone down significantly. However, we still have an issue with other flavored products. Why is this a concern in our neighborhood? Well, according to the 2020 U.S. Census Bureau, African Americans make up roughly only 5.6% of California's population. Yet, our smoking prevalence rates are still remaining around 16%, and 14% of those users smoke cigarettes. And this is according to a 2022 study conducted by UCLA Center for Health and Policy Research. Now, cigarette smoking equated to about 15% for African Americans in California, and vaping was at 5%. So, as you see these trends, we are still at one of the highest usage rates among our community. And so, we still have a lot of work to do, and particularly in educating our communities. Last year, I was in East Oakland at a church and educating faith leaders who were going to train their congregations about this issue. And half of the faith leaders did not know that there was a flavor ban policy in place. And particularly, their community was still smoking menthols. So it was clear at that time that we still have a lot of work to do at the ground level. Policy has been enacted, but where it really is going to be effective is on the ground. And that's also where we come in and also where you come in. And I'd like to introduce you to my amazing team of seasoned consultants who will be working with you throughout your time with us. Miss Carol Magruder is my program manager, and she is also the co-chair of the AATCLC, just a national powerhouse and plethora of information. The AATCLC, this parent organization, fights nationally and internationally to take menthol off of the market. Like I said, we are only one of a few states that actually have a menthol flavor ban. So this is still a prevalent issue in many of our states. Ernesto Wright, who you will be meeting later today, is our leadership development coordinator and also our community liaison. She's a seasoned professional with over 35 years of experience, and she has her own community-based organization, the Green Foundation in Orange County. You'll also be working with Dr. Karen Beard. She's our cessation tobacco treatment specialist, and she's a plethora of knowledge, and she has her own customized program discussing nicotine liberation and how it just looks different for us and that we need culturally tailored cessation services. And our Reverend Pastor Kelvin Sauls, he works with our faith leaders and particularly within our Faith Leader Amp Up program, as well as with our No Menthol Sundays that are conducted in May. And Robin Battle. Dr. Robin Battle is our program evaluator, and you'll also be working with her, and she will be giving you a training on surveying and evaluation. So, what exactly do we do as a coordinating center? Well, for the past 7 years, I have provided tobacco prevention navigation to community based organizations who are new to the field and this type of work, and also a liaison to working with the state. Also, providing customized assistance and tailored support to pretty much meet the capacity needs of projects, be them big or small. We're always able to enhance capacity to make sure that goals and metrics are met. And we offer tailored cessation support. We also help programs engage the Black community effectively, particularly those who are not well versed in our community. What types of strategies are most effective to engage in our community that actually make a lasting change? And we go into leadership development. And this is would be what you'll be involved in is our AMP Up Leadership Development Program. And we offer a plethora of trainings, workshops, and webinars. Some of the trainings and workshops and webinars that we do provide is base level tobacco 101 information. Like, let's just get you started on the history of tobacco in our nation and where we are today. We go into predatory marketing. We discuss current policy and advocacy, community engagement strategy, and we also tie this in to tobacco related diseases. In the past, we've worked with the American Heart Association, Public Health Law Center, the Green Foundation, the Loop, so many others organizations. And hopefully we can work with your organization. We also create social media campaigns for you that are accessible for downloading. We have tobacco related social media for Black History Month, our No Menthol Sunday in May, the Great American Smokeout coming up in a few weeks, Black Maternal Health Week, and so much more. And that's included in our monthly newsletters. What I'm so proud of is our culturally tailored cessation program, particularly that we have changed the narrative to nicotine liberation. And our program, Kick It Now, is set out for people who smoke and for people who have families that want to help their people to quit smoking. We have resources also for professionals, and we also have a free and proud support group. So I encourage you to check that out. It is on our website, and our own Dr. Karen Beard is facilitating those support groups, and she's available to assist you and answer questions. This is at amplify.love, www.amplify.love. So when we go out into our community, when we meet with stakeholders, when we meet with elected officials, and hopefully when you go out in the community and meet with local elected officials, you'll be able to stand united with us with our African American Tobacco Policy Platform. This is a platform that we have presented to the NAACP, to the Deltas, to various sororities, and got them to sign on. And this is something that we use when we meet with legislators in Washington, D.C. It is made up of 11 tenants, and this is also available on our website. So when you are discussing tobacco prevention, tobacco policy, you'll be well versed to know that we all stand united. So, our number one is prohibiting the sale of all flavored tobacco products, including menthol cigarettes. And just thanks to the tireless efforts of my parent organization, the AATCLC, the number one objective is much closer to fruition. But like I said, it still doesn't stop us from supporting local jurisdictions and stakeholders who seek health and want to take the health back for their communities. And that's also where you come into play with conducting a community town hall. Number two, we believe in protecting our children by making tobacco use and the predatory marketing of flavored tobacco products one of the top five priorities facing our community. And according to the CDC, tobacco product use is started and established primarily during adolescence. And nearly 9 out of 10 adults who smoke cigarettes daily first tried it by age 18, and 99% first try smoking by the age of 26. And each and every day in the United States here, about 1,600 youth smoke their first cigarette, and nearly 200 youth start smoking every single day. So we must continue to seek engagement with our youth and come up and develop innovative strategies that appeal to our culture particularly. Three, we work within our own organizations and religious institutions to mount a sustained and comprehensive campaign against the tobacco industry. We advocate for the adoption of non-acceptance of tobacco industry sponsorships, contributions, and policies. Particularly, we highlight here in California the No Menthol Sundays, California. It is something that we do year round, but particularly several congregations gather on May 15th every year, the third Sunday of the month, to host their own Menthol Sunday. This is where ministers, faith leaders get involved, Youth groups get involved in educating their congregations that can go out in the community to make a difference. And we also provide quick resources. It is a great Sunday that can be whatever the congregation chooses for it to be. It can look like a health fair, it can just look like a sermon, but it just looks like healing and wellness and change. And that's what we're so excited and passionate about. Four is understand the predatory marketing and tobacco use perpetuates poverty in our communities. Now, a BMC public health study found that social economic status is a major determinant of tobacco use. Lower social economic status more frequently have higher levels of dependence on tobacco smoke exposure. So, our community based organizations play a pertinent role in ensuring that the right messaging is reaching our people. Five, hold the tobacco industry responsible for the irreparable harm that has been done to our community. A national issue that the AATCLC has advocated for tirelessly is making sure that we keep this issue at the forefront. And particularly when we meet with the local elected officials here in California, our discussion is surrounding how can we sustain funding to educate our communities, particularly since we have such high usage rates. And six, to work with elected officials to develop a comprehensive tobacco control platform that will eventually reduce tobacco related illnesses and improve health equity in the African American community. Annually, the Amplify and AATCLC meets with the California Legislative Black Caucus, and we discuss our policy platform and how we can incorporate this into current policy, particularly policy that the California Black Caucus is advocating for. And if you're interested in being part of that meeting, it happens in May, and we'd love to take you along for that for your voice to be heard. Seven is demand adequate funding for tobacco prevention programs and culturally appropriate services to help people stop smoking. This is another important issue that we go into our legislators to discuss is that we have culturally tailored cessation support that is accessible to our people, that doesn't look like a formal hospital setting, that perhaps looks like a church or it looks like a community organization in their neighborhood. So we really do advocate accessibility to cessation. Support raising all prices of all tobacco products, especially cheap, unregulated tobacco products that have been inundating our neighborhoods and our Latin communities. And many times we are able to help get passage of tobacco retail licenses, which help with this issue that has burdened our communities. And it's so important that community-based organizations are aware of the public health issue and able to help us be advocates in our communities, especially during those times when those types of ordinances are being voted on. Your voice really does matter in the community. And nine, supporting and demanding smoke free multi unit housing and other protections against secondhand smoke exposure. The CDC indicates that African American children and adults are most likely to be exposed to secondhand smoke than any other racial or ethnic group. African American non smokers generally have higher cotinine levels, which is an indicator of recent exposure to tobacco smoke. And this is more than non smokers in any other race or ethnicity. 10 is advocating for policies that explicitly exclude civil or criminal penalties for use or possession of tobacco products. Before Senate Bill 793 was enacted, there was a lot of discussion about enacting such a bill that would ban flavors in tobacco and perhaps that it would penalize the user instead of penalizing the retailer. And of course, this did not happen, and this was something that we would never advocate for as a penalization of the actual user. But we are always advocated at a high level of a retail penalization, which is what has happened with Senate Bill 793. And we also encourage this nationally in all jurisdictions throughout our country. And finally, 11, which is our newest tenet, is to respect, honor, and differentiate between the sacred use of tobacco by our Native American brothers and sisters, contrasted against the communal harm, death, and profits over health of commercial tobacco. We will continue to work to dismantle the unceasing deadly tobacco industry complex and end nicotine addiction once and for all, recognizing that health is a foundational human right. So we hope that you'll join us in this fight and you feel that it's time to amp up. It is our mission to work collectively in love, unity, and cultural humility to educate, empower, and engage our people to end commercial tobacco use. Our AMP Up Community Engagement Activity Awards. We are able to fund up to $3,500 for you to conduct a community town hall and also to participate in our leadership program. We are able to fund up to $750. Key dates that I would like for you to note is that our AMP Up Leadership Development Program will run next year from January through May. Our application deadline is November 19th, and our awardee notification will be no later than December 19th. We'll have our first mandatory information session on January 22nd. It will be no more than an hour from 12 p.m. to 1 p.m. So, written into our grant is the Community Engagement Activity Awards. It's a funding opportunity that is solely California based, and it is for African American serving organizations that are interested in integrating tobacco control activities into their normal community work. What we've done different this time around is have a particular ask. Normally, we allow our CEAAs to choose an activity that fits their community needs. However, this is our last time around, and we really wanted to make a strong impact throughout the state in our communities. And the best way for us to do that is to conduct a community town hall that brings together great minds and voices and brings the people together. So having this be our goal, we are inviting all community-based organization and businesses and individuals to apply. Our focus areas throughout your training, because we're going to train you, we just wouldn't just throw you out there to the wolves with no information, education, and empowerment. We're going to go into detail regarding health promotion and education. We're going to discuss the policy landscape. We will talk about evaluation and research and walk you through what that looks like. And of course, managing the project, managing that town hall. And this is 100% virtual. You'll be working with some great dynamic presenters, Carol Magruder, who I introduced earlier. You'll also be working with Godfrey Ramos of The Loop, the coordinator specialist. He'll be covering hip hop and advocacy. You'll be working directly with Miss Ernesta Wright. She is our leadership development coordinator. And you will have sessions with different presenters, such as Dr. Karen Beard covering cessation, covering nicotine liberation cessation, Pastor Kelvin Sauls bringing in the faith-based perspective, and you'll have a training for evaluation surveys with Dr. Robin Battle. And at this time, let's see here, not quite. CAA AMP Up application requirements. Very important. So requirements, proposal activity summary, is your scope of work for conducting a community town hall. So this is through the application process. Please go into detail about what type of community town hall you will be conducting, and please give us a proposed budget, an explanation for the budget in detail. Now, this proposed budget must include a budget for promotion. So this would include how are you going to market the town hall. This includes flyers and social media promotion, of that light, etc. And upon acceptance of being one of our AMP Up CEAAs, you'll need to provide proof of nonprofit status, certification of nonprofit acceptance of tobacco funds, a completed W-9, and or general liability insurance certificate if it applies to you. We provide an abundance of resources and tailored resources. We'll have individual technical assistance sessions with you to walk you through the town hall. We'll also have advocacy and policy education sessions. There'll be time for networking. We have an online resource bank and so much more. So, our program deliverables. So, there will be two progress reports. Don't get overwhelmed. They're very simple, less than a page, maybe a page at best. The first progress report will be midterm. It'll just be a summary of where you're at. This list lets us know that you're on track, that you do have something in place. You have a date solidified for your community town hall. You have a layout of what your scope was going, your run of show looks like. That's just your preliminary. The final report will be due after you have completed your community town hall, and this must include pictures and or video to verify that this was conducted. During that time, we'll have two virtual check-ins, anywhere from 30 minutes to an hour. Particularly, this will probably be before you conduct your town hall to make sure that we could assist you in any way. And requirements on our end as a project, as an AMP Up project, would be a survey. How are we doing? How did we do? And then a phone exit interview. And that will be conducted in May. And it will be the completion of one community town hall that you will need to conduct, followed by a participant survey at the end of the town hall. So, on the ground, what does this look like through your work through January through May? So, one person from your organization must participate in our leadership program. The leadership program will be bi-weekly and or monthly. Normally, we have a session every other week, and the session will start on January 22nd. It's normally no more than 1 hour and a half. We try to keep it to 1 hour, 15 minutes to 1 hour. But you know, guys, the trainings are so good and we get into such great discussion. Sometimes it goes to 1 hour and a half. The duration of this time will be from January through May. Normally, we have 6 sessions, so you'll most likely finish the actual training sessions probably around March, and you'll have April and May to conduct your community town hall. And your stipend for that leadership development program, the sessions, will be determined by the number of participants. So, what is a community town hall if you're not too well versed about it? So, community town halls serve as a platform for local residents to engage with government officials or stakeholders and discuss community issues. They facilitate open dialogue and foster civic participation. Key purposes of our town hall is information sharing. Stakeholders will provide updates to inform and educate on various tobacco prevention topics. Public input is important, so our community is able to voice concerns, ask questions, and offer suggestions to build within California's Black community. Community building. Town halls strengthen community ties by encouraging participation and collaboration. And finally, transparency. They promote accountability and empowerment by allowing citizens to take action in their local community. Our formats, this could be held in a public space, such as community centers or schools, or this can be also a virtual session as well. We like to, of course, include presentations, informal discussions, perhaps a keynote presenter, and time for Q&A. So hosting an AMP Up community town hall. Amplify staff will help you, will guide you through the process and assist you with planning, whatever level you're at. Some folks might be beginners, others might be advanced and not need as much assistance from us. We would like you to choose your audience. Will it be designed for youth only or young adults, older adults, or will you be incorporating young adults and older adults or youth and young adults or all of the above? We'd like you to sort of have an idea of the audience you'd like to reach and then collaboration. We are big believers in collaborating because we do not do our work in a silo, and we don't expect you to do the work in a silo. We unify, and with unity we can grow. And so who will you be inviting? Will you be inviting another organization to participate and be a speaker, a presenter, a performer? Um, and keynote speaker. If time permits, we may be able to provide a speaker for you from Amplify to support your town hall. But please note that this person is there for support only, and they will not be the sole person featured in the entire town hall. So, like I said, the format could be virtual or it could be in person. And reinstating that a survey must be completed at the end of the town hall by all attendees. And now I'm going to introduce you to Ernesta Wright. She is our AMP Up Leadership Development Program Coordinator. She is going to be the primary facilitator of your training sessions and also be helping out with the technical assistance sessions that we'll have that will be individualized 30 minutes to 1 hour. Ernesta.
Great. Thank you, Yolanda. Good afternoon, everyone. It's a pleasure again to be able to share with all of you an opportunity to work with Amplify. And our vision is actually in the name, to amplify our voices, particularly in the tobacco education space, as well as to integrate tobacco, as Yolanda mentioned, in health topics. We understand the data that exists that with tobacco, how it has impacted our communities. And so we're hoping to develop from a statewide effort of giving you the tools as well as sharing from you as well as organizers and leaders of how can we able to incorporate and integrate this work in what you're already doing. As Yolande had succinctly and eloquently has shared what the program is all about, this is our maybe fifth year perhaps of providing this leadership to all of you, and we're going to wish you well in the competition or the competitiveness of the proposal, and that we are giving you and wanting to give those who are working or will be working with us all the tools that you're going to be needing. Although the information that was shared is quite a bit, however, we are here to handhold all the way through because we do want you to be successful. And as Yolanda mentioned about the sessions, we do start on time and we do end at a time of that hour, but we do release everybody if they need to go because we do respect your time. And so, as she mentioned, the first session is just going to be an hour of overview, so it'll be pretty light. And then in session two, that you'll be able to understand how tobacco basics. So you have enhanced knowledge as well as some of you may not be aware of some of the tobacco education or how it impacts our community. And then we know that it could be used for your career path. If it's not in tobacco, it's a public health area that you could consider, or your team members or your staff. And then in session three, we call it the 4 C's, the church, community engagement, collaboration as career. And we also have town hall discussion because throughout our sessions and through the topics, if you have a question as you develop your model for your town hall, that you're able to have some opportunity to be able to discuss it among the team members. So now those who are going to be a part of this journey, now we're developing relationships to be able to have a shared model of what is working within your community or what you're working on in Northern California versus Southern California. How do we share resources? How do we strengthen our collective partners? How do we give an idea of where we are and the support that you're needing. And we are very intentional about having one-on-ones. If you want to have set up an appointment with me or Yolanda or any other team members to be able to discuss your particular project in place, we're going to be here for you. So you have many years of experience that is at your disposal. And that we really do mean that, because we know that not just this project that we're wanting you to work on, we want you to be successful all the way through. And we're hoping that after this journey with us, that we could tag you as our partners. We do like to make sure that sustaining our own relationships, of being able to support the work that you're doing, but not just this particular program, but how do we support one another in other areas of your organizations. And dynamic of Dr. Beard for session 4, she is a dynamic presenter and funny at the same time and very knowledgeable in this space. So that is something to be looking forward to. And then the session number 5, I've heard this presentation numerous times, and I'm always often learning. It is towards the young adults and being able to understand how you could incorporate young adults into this work and being relevant and speaking their language. And then the town hall review is another opportunity to get some feedback on what you're doing and how you're doing. And if you need any other guidance or able to share ideas with one another, is another opportunity. And number 6 of the session is Dr. Battle is a dynamic evaluator. What works and what needs to be improved would be the bottom line. But she is able to explain how to evaluate and the importance of your work, so it will be able to support you beyond this program. And another dynamic presenter, and a real treat to be able to gain all the knowledge that she's have over the years. And we like to celebrate. We like to celebrate, to say thank you for everybody to be attending these sessions from January to May. And we also like to make sure that everybody is solidifying our relationships. And we really do believe that it's important to celebrate all of our endeavors. So Yolande, that is the end of my briefing of the sessions. And so you'll be able to hear from her to be able to end this orientation and what this program and what you are indeed will be delighted into learning more about tobacco education. And I do also want to add to that, even if you're not awarded, we still want you to be a part of the program in some way, and that you could connect with us to see too. So not let this be the only moment that you get a chance to hear from us, because we do have resources in other areas, and we really are good about sharing other grant opportunities for other projects. So you're part of the family, not just particularly for this particular program. Yolande?
Yes, thank you, Ernesta. Thanks for sharing that great information. And she's right. Like, don't let this be the only time that we engage with you. We do offer great resources and look to continue to build a relationship with you. And I just thought about capacity building. And after finishing our community engagement activity award of the town hall and then conducting the survey, you actually will have a tangible project to that you can report on that may help you to garner other grants in the future. You actually have a conducted a community activity with actual data to back it up, professional data. So this does build capacity of your project for future projects as well. So keep that in mind. We have publications and toolkits to help you along the way for reference. I did review the tobacco policy platform that's available for download, as well as a No Menthol Sunday toolkit. This is a toolkit for faith ministers and faith leaders, and we have developed toolkits annually. So it's updated every year, which I love. We update it with the latest information. And of course, there's educational materials available for you. And if we don't have it, we will get it for you. Everything is at your disposal to do the work and do good work. Over the past 8 years, I've worked with over 55 plus churches, community based organizations, and businesses. And it's just been a blessing. It's been a great time. It's been innovative. It's been strategic. And particularly because I allowed my community to be my community and I just guided the activity. And some of these activities I just like to point out to you that might inspire you for your town hall or however you would like to do your community town hall. Multi-unit housing presentations, secondhand smoke. That was a big concern with a lot of the organizations that participated, and they did presentations at apartment complexes, health fairs, walkathons, spoken word competitions, art presentations, art competitions. There's been community research projects conducted, listening sessions, educational materials have been developed, social media campaigns, flyers, you name it. Uh, the work has ran the gamut to just have be a plethora of beautiful tobacco prevention work for our community. We've even worked with a life insurance agent who did a Chocolate City tour throughout the state. And last summer, she toured our highly populated African American areas. She had great attendance to her different presentations, and she incorporated presentations regarding tobacco and how it affects getting life insurance. And she tied it in with cessation and stopping smoking and offering those services. We even worked with the comedian who was also a content creator. And I'd like to show you some of his work that he did with us. Keeping it real black out here in Inglewood, California. We're spreading awareness on tobacco use in the black community. I don't want to put y'all on the spot, but okay, Gina, it sounds like you are your user currently. To be honest, I used to smoke every day. But when I stopped, I went to the little vapes, the little nicotine. Yeah. And man, we all love it. I've never been a smoker. Never been a smoker. Never smoked anything. I have smoked other things. Social smoker. Oh, so you be like at the party smoking, or if I'm like extremely stressed. What leads somebody to smoking? I think seeing anybody else do it. I got a twin brother, so he picked it up like heavier than I did, but I was around him every day, so naturally I was smoking every day. I don't see a lot of cigarette advertisement. It's the vaping that they are now pushing on the community. And we're caught up into this marketing strategy, and we are an emotional people. So you think they were tugging on our emotional man on it, brother? We want to do better, and that's what this, I believe, your organization, yes, and this advertisement is all about helping do better, and that's what we want. It needs to go away. Cigarettes, and they're nasty, and they stink. All right, so a quote from the content creator. We as creators, alongside with our guests on camera, had so much fun educating ourselves, and we believe comedy is an effective tool to help get the word out about tobacco's effects on Black Americans to a wider audience. Doing this work has created a fun environment that lightens the load of discussing such a heavy topic. Joe Boyd, Black Hippie Inc. And so I hope that, this inspired you. It kind of got you thinking that you still can be creative with your community town hall and incorporate humor, incorporate arts, incorporate creativity within the educating regarding tobacco prevention. Keeping it real. So, reminder of the key dates. It will be January through May that we will be conducting our Community Engagement Activity Awards. And the application deadline is this month, of November 19th. and we'll be awarding we'll notifying the awardees by December 19th. And our information session will be on January 22nd for those who have been awarded. I'm going to stop my share right now. Thanks for bearing with me. If you have any questions, any concerns, I am available to assist you. So is Ernesta. We will put our information in the chat. Are there any questions at this time that we can answer for you?
There's one hand up. Oh, there's a couple. Rebecca, did you want to?
It looks like I
Um,
could take you off of mute. Rebecca?
Okay, thank you. I don't have a question specifically, but I just wanted to say thank you very much for all of the information. It was extremely informative. Thank you.
Oh, thank you so much. I'm glad that you enjoyed it, and please, we encourage you to apply.
Thank you.
Kalita?
Yes, good afternoon. I am really excited about this program and am curious to know if an organization needs to be approved in order to utilize the resources to perhaps build up to an event. Just thinking of timing of the year, putting something out like at the beginning of the year would probably be wise when most people are thinking about making changes in their lives for the new year.
Yes, yes, these resources are available to you, definitely. And we can meet with you to discuss what particular strategy that you're thinking of
Yes,
in order for promotion. We'd be happy to meet with you.
it will be my honor. Thank you very much.
Thank you. Any other questions so far? And if you happen to think of one, please, while we get off of this webinar, please send me an email, and I'm happy to answer your questions.
and thank you, Twyla, for your comments. I'm not sure if everybody could read them in the chat. She was sharing that it was informative, and that she
Thank you.
thanked her for attending. Yes.
Thank you. Well, we thank you for attending. We know it's lunchtime. Thank you for spending your early afternoon with us. We look forward to receiving your application. Please share this with your groups, your networks. We would love to get many applications. And like we said, if you do not get funding for this, please don't be discouraged because we still want to do work with you at any capacity. We want to keep the community growing. We want to keep educating our community. We want to keep healing. And so please join us on this fight. We have
Thank you, Bishop.
Thank you all for joining us and have a beautiful afternoon. God bless you.